Hello again, I'm Mark Kiesling.
And I'm Julie Williams. There's still a spike of Omicron cases both nationally and locally.
SIH released its latest data today on COVID hospitalizations. These are numbers as of 10:30 this morning. Carbondale Memorial had 33 COVID patients, 26 are unvaccinated. 7 are fully vaccinated. 6 of those were eligible for the booster, but only 2 had received the booster. 5 patients are in ICU. 3 are on ventilators. Of those, 1 was fully vaccinated and eligible for a booster, but had not received it.
Now, Heron Hospital also has 33 COVID patients. 25 are unvaccinated and 8 are fully vaccinated. 7 of them were eligible for a booster, but only 2 had the booster dose. 6 patients are in their ICU. 5 of them are on ventilators. None of the patients in ICU are fully vaccinated. Now, with that in mind, we called on Dr. Josh Miksanek. He's the director of emergency services at Heron Hospital.
He sat down with me for a virtual COVID conversation on the Omicron variant.
What I'm seeing on the front line, actually going to work every day, is the highest gross number of COVID cases as I've seen at any point. I go back to not the surgery we had right before Christmas, but the one before that. I had a couple shifts where I would go and it would be 80% of the people I'd be seeing would have COVID, and it was a lot of COVID patients. I'm back to seeing that many, but at this point, my average level of illness doesn't seem as high as it seemed in the previous surges. So I'm seeing a lot of people that have more flu-like symptoms. They feel really sick. I think for the viewers out there, my definition of sick is an ER doctor, and your definition of sick is a little different. So from my definition, people aren't that sick. From their definition, they are really sick. They feel like they're dying, like they have the flu, high fevers, a lot of body pain or muscle aches, vomiting, nausea, a little bit of everything. Sore throat's been very common with this round of COVID. So I think people are feeling really ill, but they're not reaching that level of severity that's needing hospitalized nearly as much as I was seeing in the previous wave. So a lot of patients I'm seeing come in, like you may see a little bit on the news of, are they all real COVID cases? No, I'm seeing people come in that have other illnesses and they happen to have COVID as well. People that know it, and they're like, just so you know, I have COVID, doc, but I'm not here for that. I'm here because I hurt my ankle or something like that. And then, we're of course admitting a few people that are being admitted for things other than COVID, but that test positive when we're screening them. So overall, ton of patients. The average level of illness, lower. Symptoms seem pretty high for especially young adults, feeling very symptomatic, but not bad enough to be admitted for many of them.
Are you surprised at the number of people you're seeing right now that are still unvaccinated?
I don't think so. I think if you look across the country at the vaccination rates, I think it's become very political. And I feel like, the politics of our region, I think that would make sense to me. I'm not really surprised. I really kind of feel like, I think we talked even in our last COVID conversation that I really wasn't feeling very optimistic that a lot more people were going to get vaccinated at this point.
It seems like there are many people being hospitalized that are fully vaccinated, but yet haven't had the booster shot. Would you see these numbers changed if this group of people who were willing to get 2 shots in most cases, a Moderna or Pfizer, are putting off getting the booster? Could you see these numbers drop down if those people were getting the booster?
I definitely think we'd see it drop some. The CDC is recommending pretty much everybody get the booster shot. I personally feel as a doctor, a lot of things in medicine are a risk benefit and a kind of discussion of your own personal health with your physician. I'm kind of reluctant to say the booster is a one size fits all, no questions asked. But I think to me, from what I see, it seems very clear if you're 60 plus, the data that we see at SIH, those are the majority of the people that are being hospitalized that are unboosted. So I think I feel very strongly with what I'm seeing in the real world. If you're 60 plus and you got 2 shots and you're eligible for a booster, it really does make a difference to get boosted in that patient population. And we know that for the flu. When we had the flu, we weren't admitting a ton of 30-year-olds with the flu. We were admitting a lot of people over 60 with the flu. We know that people in that age group tend to get sicker and tend to be hospitalized more frequently. And they definitely seem to need that extra boost of their immune system with where we're at in terms of waning protection or changing virus that the previous vaccines don't work as well against. You almost have to overwhelm them with more immune cells than you had before.
When should people get tested for COVID-19? Right now you have colds going around, you have flu season. if a person has a sniffle or a sore throat, should they go get tested to be safe, or should they wait to see if they start losing sense of taste or sense of smell? What do you recommend?
I think this is a super hard question for me because my personal belief is we've moved into an endemic phase of COVID with Omicron, where by endemic, I mean it's in the country, it's not going away, and everybody is going to be exposed to it. So, before COVID, you wouldn't run to the doctor and get a test for any sniffle. And so it's really hard almost to answer that because I feel like everyone is going to get COVID over the next few weeks if you're not holed up in your house. But I think with how high our rates are of COVID, I think with the way we're still managing things with quarantine and isolation, you probably do need to consider getting a test if you have symptoms of a cold, because while I'm seeing every other cold go around right now, I'm probably seeing 6 or 7 to 1 of COVID to those other viruses. I'm seeing those, but COVID is just such a high prevalence of what's going around right now that I think if you're sick, the odds are higher it's that than another virus this week and probably next week and probably the week after. And then I personally think we'll really see a pretty good downtick in this wave and maybe the end of it by February. So,
are you seeing more pediatric cases, and if so, are they less severe and not requiring hospitalization?
So I'm definitely seeing more pediatric cases. And I want to preface this with, I've seen so few COVID pediatric cases in the first couple of years of COVID until Omicron that it wouldn't be hard for me to say I've seen more because I saw almost none. And I've seen, probably about a third as many in the last 2 weeks as I saw in the previous 2 years combined. But that's still a very small number. And so I'm definitely seeing more. And I'm seeing those kids be more symptomatic. But what I'm personally seeing is kids with runny nose and a fever, maybe a couple with some stomach bug syndrome. I have not seen any that need to be hospitalized personally. We are seeing more total kids. They are a little more symptomatic because before they were hardly symptomatic at all. The youngest kids seem to be the highest risk to be hospitalized relative to previous waves, but it's still a small risk overall, especially compared to adults. I also wanted to mention on testing, the ER Society has kind of come out and asked people to really consider whether they're having an emergency to come just for testing to the ER because the ERs are busy and we do have a lot of patients with COVID there. So we're not turning anyone away that comes to the ER and saying, we can't see you, but it would certainly help us if you felt like I just need a test to go back to school that you don't come to the ER to try to get those tests. Okay. And I think, I told you guys this the last time I was on here, that we were going to see a lot of cases over the next few weeks. Right. And I think that's all playing out. We're seeing a lot of cases. And I want everyone to try to, maintain their sanity, that the numbers are high. The level of severity is going down on average. It still looks like if you're unvaccinated, you're at the highest risk of potentially being hospitalized. But I think this wave will hopefully end. It'll definitely, I believe, start to see its peak soon, and it'll start to end, kind of wane down by February, and hopefully be over by the end of February, the way things are looking in the rest of the world. So hang in there just a little bit longer.
All right. Dr. Miksanek, thank you so much for joining us today for this COVID conversation.
Thanks.
Southern Illinois Healthcare is operating 4 local testing sites.
Yeah, they have 2 in Carbondale, 1 in Harrisburg, and this one in Marion. Now, at times, lines have been really long, and because of that, SIH says everyone has to make an appointment ahead of time. They also say you should try to get there as close to your appointment time as possible. Now, you can make an appointment through the SIH website, your MyChart app, or through the SIH COVID hotline. The fastest way to get your results is through the SIH MyChart app. You can sign up for it on their website. Now, you are encouraged to sign up for MyChart before you make an appointment.